here in having this pathway towards the Conectaton so that we can have opportunities to learn in all of these digital transformation projects. Allow me to share my screen. Can you see it? Yes, we can see it perfectly. Very well. So the idea is to talk to you about the technical cooperation in telehealth that PAHO has for all the countries in the region, which has as one of the main components the platform called Todo en Uno, one stop shop. And it's interesting for all of you who are not aware of it, can get to know it. But I can see some of the names, and I know that some of you already are acquainted with it, but the idea is for you to start seeing some of the things that we are looking at in the coming stage. For those of you who are not aware of these, well, this is basically the four pillars that sustain the platform. One is a platform called Todo en Uno. This is a all-in-one telehealth package, and all of the municipalities, the institutions, the countries can use it as a clinical record and video consulting tool, regardless of licensing, because these are open source that allow also for scalability of these tools. Education, well, everything that has to do with with the way that we train all of the staff that will go to a teleconsultation, but not only those professionals participating, but actually all the process and all the team involved, which we normally do not keep into consideration. Also, technical cooperation to help us in the processes, in the regulations, and the way that the telehealth programs mature that we know exist in most of the countries. And then one of the big things about this program are the telehealth kits. These are packages with a digital interoperable medical devices that can interact with the all-in-one platform, but also with the clinical records and the systems that the country have made available. So let us take some time to tell you about this. But in the IDP and in PAHO, we always talk about the difficulty of the digital transformation problem, which is not really on the technological side. The difficulty lies on the organization side, and that's exactly why we want to address this. So it's not just a software platform, it's a lot more than just medical devices too. So the platform all-in-one is, as I was saying, an open source based on interoperability standard that is made up of three important axes: the electronic clinical record, with a main focus on primary healthcare and non-communicable diseases, with a high component on the follow-up of chronic pathologies, a form or a strategy of a structured records so that the countries can record everything that they do as part of the process in caring for their patients. They can create their own form, and also video consultation, which is built in order to formalize so that these video consultation process in the countries is not just in a Zoom or in a telephone call, so that it's actually part of these care process, and so that all of the information is created here can be recorded as part of the clinical record of patient. This all-in-one platform is available to be downloaded by anyone. It does not have to be a country. You can go into the website of PAHO that we have for telehealth, and you will find all of the materials. But of course, that we are available if anybody is particularly interested in helping you, technically speaking, in implementing the platform. And as I was saying, it's based on international standards. And we have the goal of covering all of the processes, these that are online, but also those events that take place in an asynchronous moment. For this, PAHO has prepared different tools. The two main tools are the maturity tool for the implementation of telehealth in a care facility, which is a tool that will allow all of those involved or that have the intention of putting together a telehealth program to know the status of that institution in order to move forward in the implementation. but also the maturity of the personal skills, which is self-managed by the practitioners who are going to be part of the telehealth service so that they can assess themselves to see if they require any reinforcement. All of these tools, like all PAHO tools, end up giving a self-assessment result with recommendations based on the level of maturity that the different tools have. But as I was saying, the tool has not only been thought for a synchronous or asynchronous service, but also for the different interaction models. That is to say, if it's ideal, it's a patient with a professional, but also it could be a professional in connection with another professional to have another opinion, or also technical teams in connection with a professional for those cases in which they require the distance support or remote support. And the only possibility maybe is having a technician, maybe even a nurse that can help in connecting and collect the information and then conveys it to another center. It has also been thought for all of the different uses, care of children and adolescents all the way to the elderly, going through primary health, healthy adults, women's health, pregnancy, and chronic disease. So the clinical records comply with all the services that we have thought this tool for. And as I was saying, one of the most attractive things in this technical cooperation program has to do with telekits, which are digital and medical devices that are connected to the different clinical records that are mobile and that are portable and allow for vital signs, electrocardiograms, echographies, also a scale. And all of these devices are digital. The most common one is this one here on the left, this suitcase or briefcase, which is the telehealth case, which has an EKG and it has a temperature probe and oxygen saturation, and also a monitor to measure blood pressure. All of these devices were selected by the different PAHO techniques in order to be standardized, high quality, high durability, and an effort has been underdone to make sure that they can be placed into this rigid container because the countries asked us not to have issues in having to store all of these devices that can get lost and that can get stolen. So they are all integrated in one single case, and they are connected so that they can be loaded also or charged with only one outlet. Because one of the issues is that we have to look for, we have 5 different devices, 5 different outlets in order to make sure that you can charge them all. So it's been important work of all of the technical parts of PAHO, not only in selecting the different devices, but to make sure that they are with a tablet, one case, all being charged with one single outlet, and that they are safe. And if they are removed from the case, it's useless because then they cannot be used. We also have a tool in order to measure the infrastructure that the different health institutions need in order to move forward in the project, and which is divided in the number of reference centers, low or high complexity hospitals, primary care center, and how many health equipment. So with this, they can calculate how many kits they need or how many computers they need in order to move forward with the project. But there's an additional component that I have said that is very important, which is education, a set of courses that has been thought with a major goal in mind, which is training professionals that provide a telehealth service in one innovative and fun course. For those of you who have not gone through it, it is available for free in the PAHO campus, and it's based on stimulation and gamification. So when a person interacts with the course, they are gaming, they are playing, and that allows you to acquire these skills in order to provide a proper service and what conditions need to be kept in mind in order to move forward. And the other courses are for the teams that are implementing telehealth programs, because it has to do with the introduction to interoperability and FHIR standards, integration in telehealth, and another important course, which is a change management in the telehealth programs, which is a strategy, but it's actually focused on telehealth. So we're very happy with these courses. All of these courses have involved over 70,000 students, 70% of which are women, 30% nurses, 20% doctors, and 50% other professionals in the health sector, mostly working in primary care, and it has covered 113 courses. These courses have been taken by countries outside of Latin America. So although this project is focused in our region, it has also gained interest in other areas. So in principle, let's go into what you really are interested in, which is looking at the platform live. Allow me to share the following screen. Can you tell me, please, if you see it? Can someone say okay?
Estamos viendo el buscador de pacientes.
Yes, sir, we can see the patient search page. This is the PAHO clinical record. It's a platform which is highly friendly, very intuitive. It really requires very little training. And not only is it for the medical professionals, but it also considers the technicians, nurses. They all have a profile adapted to their role, and which can be used with minimum infrastructure requirement, very low connectivity, but also very low storage in order to set up the platform. The institutions, the countries, the regions can do their own setups. They are not using the same platform, and then PAHO finds out all of the patient's data. No, not at all. Each country, each institution can do their own setting up, and that they have a device which is open source and that they can use with a very friendly approach as a transition tool until they have their own system, or as an information system for their own as a country or as a region, because the development can be scaled because it's open source. Or even we have regions that have used it as a training strategy because it's very simple, and these can be used to train professionals not only in telehealth but also in the use of electronic medical records. It's a highly intuitive. You can select the patient. We will always see the patient summary. And then from here, we can create new appointments that these patient may need. Once we have created an appointment, we have different ways of interacting with the software. We can create a clinical note. This is free text when we can type in what's wrong with the patient. We can also use a SOAP system that allows me to do this in 4 different categories, SOAP. We can also load the vital signs. We can even have some annotations if it's too high, if it's out of range, if it's we can even put some actions, like, for example, setting up a reminder, and we can also record the health issues that are coded. We also know that there are countries that are in the transition of to CIE 10 to CIE 11, but the idea is for you to, if you want to do the direct transition, it looks for the disease in CIE 11, and then it'll be fully classified. The other module is for non-communicable diseases. It's a form that is structured but can be adapted based on the needs and the variables that PAHO has requested as a report for the countries for the follow-up of chronic diseases, but that each country can adapt according to their use, in fact, including additional pathologies. In demo, for example, we have cardiovascular diseases, diabetes, asthma, and also oncologicals, and we can click here the type of treatment and the complications that they have, if they have the right laboratories for the care strategy, always based on the guidelines, but that are adaptable to whatever the country wants to implement. So this is how the tool has been put together. The other great advantage, which is the third module, is the record. This is a teleconsultation. So we can create an appointment for the patient. Let me create here an appointment. We can say that it's in the center or it's teleconsultation. And once we have created the teleconsultation, it will show the hyperlinks. And a hyperlink for professionals, which is the one that we're going to be sharing with the practitioners. So one is from professional to professional, and another one is for the patient. That hyperlink can be sent through messages, WhatsApp, email, or the portal. And the practitioners, as well as the patient, will always be in the context of the electronic medical record. And this opens up a new window. Let me share this with you.
Ahí les estoy compartiendo la pantalla de la teleconsulta. Esto lo que hace es abrir una pantalla.
And this opens up the window where we have the possibility of having the clinical evolution as we're doing the consultation. We can share files with the patient and that they can also send files to us. We can interact with through the chat through a chat pod if we want to clarify anything that has been understood or if we want to give a written prescription, but we can also upload a form of prescription if we want them to buy a medication, for example. Obviously, each implementation has got to be adapted in the different countries according to the regulation, the processes, and the programs that each country has. But the scope is there so that it can be used. And we believe that this is important because this module does not require a license. You can see that it's very simple to create the appointment so that the patient and the practitioner can join. And everything that we write here on all of the documents that we exchange will go immediately to the record, and then we have the objective met. That is, that all the care process within telehealth falls within the clinical record and that nothing is lost. This is, in a nutshell, everything that the telehealth technical cooperation has. And we have called it the technical cooperation because it's the way that PAHO can provide help to the countries to support the countries in the development and the maturity of the programs. Because countries do not necessarily have to adopt the tools that PAHO makes available in order to access to these educational resources. But they just need to request it so that we can say how do we select the devices, how they can buy the devices, which are the things that we had to keep in mind in order to implement the program, why we decided to go with a structured forum strategy, all of that technical cooperation that we can offer the countries. And we are open to receiving questions, whether it's virtually or when we see each other face to face. So I'm available if anybody has any questions or suggestions.
Puede levantar la mano si tiene alguna consulta
If you
también.
have a question, you can raise your hand or you can type it in the chat pod. Do we have any questions or any doubts, any comments?
Laura levanta la mano, adelante.
Laura, you've raised your hand. Go ahead, open your mic.
Hola, buenas tardes. Laura Blanco de
Hello,
Costa
this is
Rica.
Laura Blanco from Costa Rica.
Me conecté un poquito tarde
I
porque
logged in a little bit late. I was
sí,
solving another issue, and I don't know
en
if you
esta
mentioned
solución, digamos, con
in
el
this
kit
solution with
seguro
the
se
telehealth
ha,
kit,
se ha
if
implementado en algunos
it
países
has
y
been
cuáles son los
implemented in any
requerimientos
country and what the
en
experience has
esos
been
lugares para
in
efectos de la
those
integración de la información
places for
digamos, con la
integrating
solución que
the
ellos ofrecen en
information
el
or with
país
the his
y,
solution that the
y
country
la
already has,
herramienta o el software que
and
nos
the tool
presentaste
or
ahora
the software that
para
you have talked to us
someterla.
about today. Yes, there's experience in several countries. About 7 countries have received telekits or that they have purchased them through some funds because these telekits have a very low cost. It's about $670, and they can be purchased through these rotational funds, which is the way that countries normally use to buy vaccinations. So if you are from the ministry, you're probably familiar with that. But if you're not from the ministry, then you might not be acquainted, but you can approach the PAHO office to see how they can be purchased. And yes, they are a very low price and very good quality. And countries like Uruguay, Panama, Trinidad and Tobago, Guyana, and in fact, also Mexico will be buying some equipment. Bolivia too. They have started buying some of these equipments, and the option is they are digital and they can be used with an analog approach. But ideally, since they are interoperable, they can be connected to the IT systems. That is the one that the PAHO has or the ones that countries already have. So Costa Rica already has its own HIS, so it could be integrated in order to transmit information. Thank you. Excellent. There's a question in the chat, but it says the question if it is Jitsi meat. Yes, and it is a Jitsi. The base of it is Jitsi. Are there any other comments? Doubts, suggestions, proposals?
Adelante, Alexander.
Go ahead, Alexander. Hello, can you hear me? Yeah, we can hear you. Yes, I was asking about whether it uses Jitsi.
Eso es parte del desarrollo que hicieron para integrarlo a su plataforma.
Sí, y si, de nuevo, por eso siempre hablamos de cooperación técnica. Si
We
vos ya
always
tenés
talk about technical cooperation. If you already have an implementation that is based on Jitsi and you want to receive technical cooperation in order to decide on how to solve the uploading of files, yes, you can get in touch with the country office. They will get in touch with us, and we can provide you with the necessary support.
En el dado caso que ya tenga un GIS,
and if we already have a GIS, and that is connected to Jitsi Meet, then we can make the connection between Jitsi Meet to our HIS. And we do that sometimes through the chatbot with the patient, and we're wondering if that can be done here too.
La última parte no te escuché.
My apologies, Alexander, but you got cut off.
No te estamos escuchando.
Se pierde
We-
su audio, Alexander.
Can you hear me now?
La última
Okay.
parte no te escuchamos. Que tenés tu GIS, que tenés Jitsi.
Yeah, you said you've got your HIS, and you've got Jitsi, and you're going to be sending information from Jitsi to your records. And the last bit of the question, we didn't quite get it. So we already have that going from Jitsi to our HIS. So we do that. From the Jitsi chat, we extended the information from there. Is it possible to do something similar? Yes, of course it is. Absolutely. Okay, so in that case, you have to go then to the PAHO country office, and then they will get in touch with us, and we'll provide you with the necessary support.
Ahí Adriana nos contacta desde Ecuador. Hola Adriana, ¿cómo estás?
Adriana is getting in touch with us from Ecuador. Ecuador has made quite a lot of progress, and it says, well, none of the modules are determining. I mean, you can implement the application, you cannot request devices or the other way around too, or you can get in touch, just as Alexander has said, in trying to solve a module. There's no particular requirement. It's not like you have to take a full package. You can take it by parts, or you can simply take advantage of whatever element you may need. Well, excellent then. I think that this is our first contact that we have before the October event. And as I was saying, it's just for us to get to know each other and to be in communication for anything that you might need in the future. And if you have any doubts with PAHO, you always have to get in touch with the country office. They will get in touch with us and we will address you. So if you have any requirements, make sure to follow that procedure. I want to thank Raxel once again for this opportunity to share with you what we're doing and how we have moved forward together in the telehealth approach. No, thank you, Charlie, for your presentation and for your time. Let us remember that this presentation will be available in the Rexel YouTube channel. Fernando, do you have any final comments? Yes, we will be doing any exercises, with this in the Conectaton. Maybe Charlie, you can tell us whether we will see part of that in the Conectathon event. Yes, of course. I'm working with Fernando and with all the technical teams in order to be as well prepared as possible. We will be just like one additional country, so we are equally working just like you, and we're going to try and have a delegate so that everybody can get to know it. So we'll do all of our efforts. The platform will be available for people to use it in whatever space we meet. So we're going to have an interactive section too. Yes, absolutely. Okay, so those who go to the event will have the possibility of interacting with it. Well, thank you so much, everybody, all the attendees, and we shall see each other in a couple of weeks, but we will let you know through the formal channels that we have, and we will be sending out the links. Thank you so much. Have a great rest of the week, and we'll see you in 2 more weeks.
Estamos positivos.
No, gracias.
Adiós.
Hasta luego.
Adiós.